What are the health effects of smoking?
They range anywhere from cancers to circulatory problems. Lung cancer is by far and away the most well-known. Mouth and nose and throat cancer, esophagus cancer, stomach, pancreas, kidneys, bladder cancer, as well as bone marrow and blood cancers. Smoking tends to raise your blood pressure, and it also raises your heart rate. It narrows your blood vessels and also thickens your blood. So what this does is it actually ends up creating blood clots for a lot of folks. In addition, smoking is associated with diabetes. We know that the toxins in cigarette smoke actually lend to the development of type 2 diabetes and your ability to control your blood sugar. And it complicates a lot of the associated disorders that are associated with type 1 diabetes as well.
Is smoking more damaging to our health as we age?
As people get older, they have a lessened ability to fight infection, and smoking definitely exacerbates that. So you'll see a lot of older individuals who smoke getting chronic bronchitis, getting pneumonia, things like that. In addition, smoking contributes to other disorders that are known to affect older individuals, like dementia and Alzheimer's. Older individuals tend to have been smoking for a longer period of time, and the duration of time that you've smoked contributes to the development of all of the other diseases associated with smoking, like lung cancer, like circulatory and breathing problems.
What are the health gains of quitting smoking?
The health benefits associated with quitting smoking happen almost immediately. Within 20 minutes of stopping smoking, your blood pressure goes down. Within 12 hours of stopping smoking, your carbon monoxide levels in your blood return to normal. And then we have this other, the longer term, anywhere from 2 weeks to 9 months, we start seeing improvement in your lung function. Improvement in your cholesterol levels. And then if we're looking at really long-term effects from 1 year to 15 years, we see that individuals at 1 year, for instance, have half of the cardiovascular risk that they did when they were smoking. At 15 years, they are back to the cardiovascular risk they were when they were a non-smoker.
Are the gains as great for someone who has smoked for decades?
And the health benefits of stopping smoking are the same for everyone. So these effects that we see when people stop smoking will happen whether or not you have been smoking for 50 years or 2 years or 2 weeks. Your body will change and start to repair itself. We have a lot of individuals, patients of ours and folks who participate in our research studies who are over 70 who have quit smoking and say, wow, I didn't realize it was this easy. And I didn't realize how much better I would feel immediately. My energy is improved. I can breathe more easily. My skin looks better. And it's really, really remarkable.
Does genetics play a role in smoking?
There are genetic differences in people's propensity to start smoking and stay smoking. And there's also differences in people's response to therapy to stop smoking. That makes sense. And that could be medicinal therapy, like pharmacological therapy, like medicine, and it can also be behavioral therapy. So it's interesting, the way that we're made, the way that we're built really determines our responses to our environment across a host of different factors.
How can you quit?
What we find overwhelmingly with our patients is find your motivation to quit. Maybe it's health benefits, maybe it's cost, maybe it's because you have personal experience with someone with COPD and you've seen what that looks like, and maybe you just want to show your kids that it's possible to change, or the people around you, that you can make this change. Finding that motivation is really key to getting it done. I've found that once people get there, into that stage where they're motivated, they can use any method to quit.
What about e-cigarettes?
If you are using them as a cessation method to get yourself off of traditional cigarettes, there's a few issues. Number one, they have nicotine in them, so you're not really reducing your nicotine load, and it's delivered in the same way as a regular cigarette, so it's very addictive in that method of administration. In addition, you're engaging in that similar behavior to smoking a traditional cigarette. So in the psychology of addiction, that's not doing you any favors. Most of the folks that I know who go from cigarette smoking and celebrate that they've quit by using an e-cigarette, within 2 to 3 months are back to smoking those traditional cigarettes.
For more information about the effects of smoking and methods of quitting, go to the website of the Centers for Disease Control and Prevention.